20 minutes after 10 o'clock. Thank you for tuning in. Nice looking Wednesday out there. Mother's Day is coming up, and I was watching this thing, Robin. These ladies who are a little bit depressed because Mother's Day is coming up, and that's what they would like to be more than anything else in the world is a mom.
Yeah.
And so if that's what you can relate to, if maybe you've been trying to get pregnant and it's just not happening, and you're hoping for some kind of a miracle, maybe Dr. Eve Feinberg has some ideas for you. Dr. Feinberg is on the phone. She's a reproductive endocrinologist and the medical director of Northwestern Medicine, Fertility, and Reproductive Medicine in Highland Park, Illinois, talking to us about the latest research and treatment options available for infertility. And I'm guessing things have changed a lot since those days when I guess I was in the man's side of those shoes, you know. Mm-hmm. Our job is easy, you know.
And fun, I
hope. Dr. Feinberg, good morning, doctor.
Good morning. How are you?
I'm good. Are you in Illinois right now?
I am. I'm sitting here in Chicago.
All right. How's the weather today? We'll start easy. It's an easy question. How's the weather?
So warm for us. It's probably in the 70s today. Nowhere near as warm as Florida.
So is there hope for women today, or I should say couples? Is there hope for couples today that wasn't there just 10 years ago? Has technology made it a little bit easier for doctors like yourself to help with a couple that's having trouble getting pregnant?
Yes, and I think the best part about it is that our treatments are constantly improving. And so most couples who come in who are having difficulty getting pregnant will ultimately be able to conceive.
Really? That's good news. And could you have said that a decade ago?
No, I think the treatments are getting better, and what we're realizing is that the more that couples stick with treatment, the higher the likelihood ultimately that they'll be successful. And you can't look at it as a one-shot deal. You have to keep going.
So when the women come in for this treatment, are they guaranteed that this will help, or is there still no 100% guarantee because of whatever is wrong with their body?
Correct. There's never 100% guarantee. And a lot of the times it just depends on how far down the path of infertility treatment a couple wants to go. I always say that there's always a way to make a baby, but it may not be with a woman's own eggs or her partner's own sperm, or she may not ultimately be the one to carry that baby. But we have the ability with pretty sophisticated and complex treatments to help couples have children. Sometimes we're just creative.
Do you know, and this is a subject that, I mean, we used to only see on those talk shows like Phil Donahue and stuff. Mm-hmm. But maybe a month or so ago, my nephew was here with his wife, and she was pregnant, and I had no idea that she was pregnant. And then she said, oh, because we broadcast from the mall, just so you know. So she said she was here to meet the baby's mommy and daddy, and I said, "What? To meet the mom and dad?" So my nephew's wife, my niece, I guess, was also a surrogate. I thought, well, that's amazing. I don't know the story. I don't know what she was actually biologically doing, but isn't that amazing?
It's incredible, and I think the women who volunteer to carry for other couples are just some of the most amazing women that we meet. And I think that ability to profoundly change another couple's life is incredible.
Does this happen to women in their 20s and 30s, or is it more prevalent if someone's over the age of 40?
Yes and yes. So the reasons for infertility vary by age, but infertility is incredibly common. It affects 1 in 8 couples. And for younger women, we often will see issues like the inability to ovulate or anatomic distortions in their fallopian tubes that may prevent fertilization, or things like fibroids. We also will see premature menopause or early ovarian failure in younger women. But in older women, a lot of times the only reason for infertility has to do with egg quality and egg quantity. And that's an increasing problem as women get older.
And can that be improved with lifestyle or diet?
No. So it's we cannot overcome the impact of age, and I really can't state it enough that age is the single most important prognostic factor as to whether or not a woman will ultimately be able to get pregnant.
Is the man's sperm at fault sometimes?
Yeah, so about 40% of infertility is solely due to male factor, and in 35% of cases, we see issues on both male and female sides.
Oh, really?
And so I think people inappropriately think, oh, infertility, it's a woman's problem. It really has to do with both sperm and egg.
So do you, in your job, I mean, do you have to be a psychiatrist or a psychologist, I guess, part-time in order to work with people who are... No?
Yeah, so I'm really lucky. I practice at Northwestern, and we're a large academic institution, and we have 2 full-time psychologists that see every single one of our patients. But, with that being said, I think there's a fair amount of compassion and counseling and empathy that is required of me in my day-to-day job. I always joke I'm like 80% scientist and 20% therapist. But I do have, full support and help available for our patients.
Are you involved with the research to try to make the treatment options better?
Yes. Yeah, so in our division, we do a lot of research. Some of my research specifically looks at markers of egg quality and markers of competence of the eggs. But we also do a lot of clinical research where we try to figure out some of my areas of expertise are racial differences that we see in infertility, and then predictors of IVF success, and we do a lot of different types of research in our division at Northwestern.
In the years of doing this, is there anything that surprises you?
I mean, I think I'm surprised every day in my job for lots of different reasons. I think what surprises me most is sometimes there are couples where in the back of my mind I think, ooh, I'm not sure this is going to happen. And it happens. And then I think conversely, shockingly, sometimes where you think it's going to happen, it doesn't happen for some couples. And so, so it keeps you on your toes every single day. And I think that it's a field of medicine where the stakes are very high emotionally and financially, and you really have to give your best to every couple before you.
Are there reproductive experts like everywhere, or can you give us a website to those who are listening right now who are saying, oh my gosh, get to the point, I want to find out what I can do? Obviously a radio show is not going to tell you what to do, but maybe you can direct us who to go to. Is there anything?
Yeah, so there's the society. There is. So the Society for Reproductive Endocrinology and Infertility is a listing of all the board-certified reproductive endocrinologists in the country, and that's SOCREI.org. And you really want to see a board-certified specialist to help with fertility problems.
All right. Dr. Eve Feinberg, thank you for what you're doing. You're making people's lives a lot better, and thank you for taking time to talk to us on the radio to help spread the word.
Thank you for having me.
You're welcome. We'll be right back. Here is your 1-minute news brief from the source WOCA. A Gainesville man was killed by the victim he attempted to rob outside of a movie theater. The victim had a concealed weapon. A professor at the University of Florida has invented a device that can detect illegal credit card skimmers. He calls the invention the Skim Reaper. Authorities in Tallahassee have arrested the widow of a man who was reported missing in 2000 and whose remains were found 5 months ago. A body was found burning on a mattress underneath an overpass on I-4 early this morning in Orlando. The Florida Supreme Court is weighing whether a 5-year-old Florida girl can have 3 legal parents. The 3 parents are the girl's mother, her biological father, and the man married to her mother at the time of her birth. And the Walt Disney Company's theme park division posted increased revenue and attendance in the second quarter of 2018. The company announced yesterday revenue increased 13% to $4.9 billion. And that is your news brief from the source.
Keep up with what's going on in the downtown area with Ocala Downtown Newspaper. Delivering thousands of newspapers to businesses in the downtown area, Ocala Downtown is there to keep you informed. They even have Tom's Picks, a free referral for people who are looking for a company to do work for them. Tom's Picks will refer the company that fits your needs, and all we ask in return is that you tell them where you heard about it. It's simple. For more info, just call Tom's Picks, 352-804-1223, and pick up your copy of the Downtown Ocala newspaper today.
And now read Ocala Downtown newspaper online.
April showers bring May flowers, but May is easily the most special month for Palm Garden of Ocala. Nurses Week is the first week of May, and we have award-winning nurses and CNAs taking care of our precious residents. National Nursing Home Week begins on Mother's Day and is filled with special events. May is the perfect month to come visit before our services are needed. Palm Garden Rehab is located on the corner of 27th Avenue and 34th Street.
The weather is brought to you by myfwc.com. Safe boating is no accident.